Hey everybody, so today we're gonna talk about chiropractic care. Is it a scam? Is it a pseudoscience? There's lots of videos of people getting cracked. Well, we don't like to call it cracked, we call it adjusted. The reality is humans have been moving bones for all kinds of health ailments for thousands of years. I actually talk about some of the history of adjusting spines and joints in my book, which you can get here in the office or on Amazon, link in the description. Now, the cool thing is that chiropractic care, specifically adjustments, have been intensively researched over the past 20 to 30 years. And those research findings are helping us understand exactly how an adjustment impacts human health and performance in a positive way. In the scientific literature, adjustment is usually referred to as spinal manipulation or spinal manipulative therapy or SMT. I mean, I like adjustment better. Who wants to be manipulated? So let's dive into some of the myths about chiropractic care. First, is it a pseudoscience? Is it not scientific? Is it just cracking bones? The answer is no, it's a lot more. These are the top 8 benefits of getting adjusted that research has proven. Number 1, reducing pain and inflammation. Number 2, improving strength and coordination. Number 3, improving posture and spinal alignment, which we can see on an X-ray. Number 4, decreasing cortisol levels. Number 5, normalizing range of motion and improving mobility. Number 6, relaxing tight muscles. Number 7, breaking up scar tissue. And number 8, changing brain and nerve system function. Is it just cracking bones? Oh God. Well, no, it's a lot more. One of the really interesting things that research is showing is that an adjustment can change brain function, can shift the brain from sympathetic to parasympathetic. So from fight or flight to rest, relax, and heal mode, which is so important for us today. And that's why in so many of the adjustment videos, we hear these amazing responses from people like sighs and, well, other noises.
Oh! Oh. 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 Blood of Jesus.
Spinal manipulation is in fact one of the most researched healthcare procedures. We continue to learn more and more about how spinal and other joint adjustments can optimize human health beyond just pain relief. So I think we've dealt with the idea that chiropractic is a pseudoscience or is in some way not scientific or backed up by research. Okay, so here's another area. What about the fact that chiropractors tell their patients to come in 2 or 3 times a week? Is that actually needed? Is it a scam? Is the chiropractor trying to take your money? As a practicing chiropractor, I can tell you that you learn pretty quickly that patients do better when they come in more often, especially at the beginning of care, and especially if they have a chronic problem. If someone's had back pain or headaches or shoulder problems for years, that is not something that is going to resolve quickly. It goes against the laws of the human body and how quickly tissues can change. The cool thing is, through research, we're beginning to understand why this is true. In a 2020 randomized clinical trial, patients with chronic low back pain were adjusted every other day for 5 weeks. So basically 3 times a week for 15 visits. After this time, they showed changes in brain metabolites associated with less pain and disability. The control group who wasn't adjusted had none of these changes. This study is really cool because it shows how an appropriate frequency of chiropractic care can change the nervous system, which is something that chiropractors have talked about for many years. Chiropractors have always talked about the importance of the adjustment improving nerve system function, and there are more studies coming out every month that are demonstrating this. And this study is just an example of how an appropriate adjustment frequency, 3 times a week for 5 weeks, has a big impact on chronic pain and changes the nervous system and brain in a positive way. Another study from 2014 showed that 12 visits done over 6 weeks, that is 2 adjustments a week for 6 weeks, was an appropriate amount of time to show benefit. In other words, a minimum required dose. It's pretty typical for me to have patients come in 2 or 3 times a week for a little while in order to get the changes that they're desiring, just like it's talked about in these studies. Now, that doesn't mean that you can't benefit from continuing to see a chiropractor after that time, but starting with that is a good guideline to go by. If you're thinking of seeing a chiropractor, I'd really recommend that you go often enough and long enough to give time for the improvements to happen. Remember, you wouldn't work out once or twice and expect to have significant changes in muscle mass or fitness. The same goes with chiropractic care. Chiropractic, being a physical modality, requires time and repetition in order for tissues in the nervous system to change. It would literally take me years to cover all the research in this area. But here's a small sample that I hope will help you clear up some of the myths and misconceptions about chiropractic care and adjustments. Thanks for watching. Please like and subscribe. for more content on chiropractic care, diet, and exercise that's going to help you live an optimized life.